Another day, another video of first aid by Top 5 OTC Medicine for High Blood Pressure. First aid by High blood pressure is a condition in which the pressure of the blood flowing through the arteries is higher than normal. It can cause damage to blood vessels, organs, and the heart. It is a major risk factor for heart attack, stroke, and other serious health problems. Fortunately, there are a variety of over-the-counter medications that can help to manage and reduce your high blood pressure levels. In this video, we will discuss the various types of over-the-counter medicines available to treat high blood pressure and the pros and cons of each. Over-the-counter, OTC, medicines are medications that can be purchased without a prescription from a doctor. They are used to treat a variety of conditions, including high blood pressure. OTC medicines for high blood pressure can help to lower blood pressure levels, reducing the risk of stroke, heart attack, and other health complications. These medicines are generally safe and effective, but it is important to talk to a healthcare provider before taking any OTC medications. OTC medicines for high blood pressure. Diuretics. Diuretics are a type of over-the-counter, OTC, medicine used to treat high blood pressure. They work by helping the body to eliminate excess fluid and salt, which reduces the volume of blood in circulation and therefore lowers blood pressure. Diuretics are usually taken once or twice a day and can be taken with other blood pressure medications, such as ACE inhibitors or beta blockers. Diuretics are generally safe and effective, but it is important to consult with a doctor before taking them to ensure the best possible outcome. Beta blockers. Beta blockers are an over-the-counter medicine used to treat high blood pressure. They are a type of medication that works by blocking the effects of certain hormones, including adrenaline, on the body. This helps to lower the heart rate and blood pressure, reducing the risk of heart attack and stroke. These medications can be taken in pill form or as an injection. They are generally safe and have few side effects. Beta blockers have been shown to be effective in reducing the risk of heart attack and stroke in people with high blood pressure. They are an important part of treatment for people with hypertension and can help to keep their blood pressure in check. Calcium channel blockers. Calcium channel blockers are a type of over-the-counter medication used to treat high blood pressure. These medications work by blocking the calcium channels in the heart, which can help to reduce the heart's workload and lower blood pressure. Calcium channel blockers are typically taken twice a day and can be combined with other blood pressure medications for increased effectiveness. While these medications are generally safe, it is important to speak to a doctor before taking any over-the-counter medications, especially if you have other medical conditions. Alpha blockers. Alpha blockers are a type of over-the-counter, OTC, medicine used to treat high blood pressure. They work by relaxing the muscles around the arteries and veins, allowing the blood to pass through more easily. Alpha blockers can be prescribed in combination with other medications to help control high blood pressure levels. They are generally well tolerated and have few side effects. It is important to talk to your doctor before starting any OTC medication to make sure it is the right one for you. Vasodilators. Vasodilators are over-the-counter medicines used to treat high blood pressure. They work by widening the blood vessels, which helps to reduce the pressure inside. Vasodilators can be taken as a pill, cream, or intravenous injection. Many people find that taking these medications regularly helps to maintain healthy blood pressure levels and reduce the risk of heart disease. Additionally, some studies suggest that taking vasodilators can help to improve blood flow to the brain, which could help to reduce the risk of stroke. Potential benefits of OTC medicine for high blood pressure. Control blood pressure. OTC medications can be a great alternative to prescription medications for people with high blood pressure. By taking an OTC medication, patients can control their blood pressure and reduce their risk of heart attack and stroke. OTC medications are also generally more affordable than prescription medications and can be taken without a doctor's supervision. Additionally, OTC medications can provide relief from certain symptoms associated with high blood pressure, such as headache, dizziness, and fatigue. Taking OTC medications for high blood pressure can also help to improve overall health and reduce the risk of developing other medical conditions. Reduce risk of heart disease. High blood pressure is a major risk factor for heart disease, and the use of over-the-counter, OTC, medicines could be beneficial in reducing this risk. OTC medicines such as aspirin, beta blockers, and ACE inhibitors can be used to help lower blood pressure and reduce the risk of heart attack and stroke. There are also other lifestyle changes, such as diet and exercise, that can help lower blood pressure. By taking OTC medicine and making positive lifestyle changes, individuals can reduce their risk of developing heart disease, decrease the risk of stroke. The potential benefits of over-the-counter, OTC, medicines for high blood pressure are significant. Studies have shown that these medications can reduce the risk of stroke and other cardiovascular events. High blood pressure is a major risk factor for stroke and can be managed through lifestyle changes, such as diet and exercise, as well as medications prescribed by a doctor. OTC medicines can help to lower blood pressure by decreasing the amount of sodium and other electrolytes in the body, thus making it easier for the heart to pump blood and reducing the risk of stroke. Additionally, OTC medications can also help to reduce cholesterol levels in the body, which can further reduce the risk of stroke. Finally, the use of OTC medicines can help to reduce the risk of high blood pressure, allowing people to make healthier lifestyle choices and ultimately reducing their risk of stroke. Potential risks of OTC medicine for high blood pressure. Drug interactions. OTC medicines for high blood pressure can be a convenient and cost-effective way to control hypertension. However, there are potential risks associated with taking these medicines, such as drug interactions. If you are taking other medications, it is important to be aware of the potential for drug interactions. These interactions can occur when one medication affects the way another medication is metabolized by the body, or when two medications interact to cause an adverse reaction. It is important to speak to your doctor or pharmacist before taking any OTC medicines, to ensure that they are safe to take with your other medications. Side effects. Taking over-the-counter, OTC, medication for high blood pressure can have serious side effects and potential risks. These can include dizziness, headache, tiredness, nausea, stomach pain, and swelling of the feet, ankles, and hands. In addition, it can cause irregular heart rhythms and a rise in blood sugar levels. Individuals taking this medication may also experience increased sensitivity to sunlight, increased urination, and dry mouth. People with pre-existing kidney or liver disease should use caution when taking OTC medication for high blood pressure, as it could worsen their condition. It is important to speak with a doctor before taking any OTC medication for high blood pressure. Overdose. Overdosing on over-the-counter, OTC, medications for high blood pressure can have serious health consequences. OTC medications are not regulated in the same way as prescription medications and can be taken in higher doses than recommended. Taking too much of an OTC medication can lead to an overdose, which can cause symptoms such as nausea, vomiting, confusion, dizziness, fatigue, and in some cases, even death. It is important for people to be aware of the potential risks of taking OTC medications for high blood pressure and to follow the recommended dosage instructions. Anyone who experiences any of the symptoms mentioned above or any other unusual or concerning side effects should immediately seek medical attention. Thanks for watching.